The future of work, why mental health is the key to a thriving workplace. We are here to discuss something that affects every organization, every industry, and every person: mental health in the workplace. Whether you're running a large corporation, a fast-growing startup, or a small business where everyone wears multiple hats, mental health isn't just important, it's essential. I'm Sabira Arafin. As an entrepreneur, researcher, and author, I've seen firsthand how mental health impacts not just individuals, but entire companies. It affects productivity, retention, innovation, and even long-term health. A workplace that prioritizes mental well-being isn't just a nice-to-have, it's a competitive advantage. Why mental health is a business priority. We know that happy employees are the most productive ones. Research from Harvard Business Review shows that companies with strong mental health programs see 4 times higher employee engagement. The World Economic Forum has proven that for every dollar invested in mental wellness, businesses see a $4 return in productivity and reduced absenteeism. Now, let's talk about what happens when mental health is ignored. Studies from MIT Sloan Management Review found that toxic workplace culture is the number one reason people resign. The World Health Organization estimates that depression and anxiety cost the global economy over $1 trillion every year in lost productivity. But the impact goes beyond the workplace. Chronic workplace stress isn't just bad for business, it's bad for long-term health. Research from Harvard Medical School shows that high stress actually affects cellular health, shortening telomeres, the protective caps on our DNA. This accelerates aging and increases the risk of diseases like heart disease, diabetes, and even cancer. This means companies that fail to address mental health today may not only see higher turnover and lower performance, but they could also be contributing to their employees' long-term health risks. And here's something that business leaders need to take seriously. Mental health is becoming a workplace liability. Just as companies have been sued for physical injuries at work, we are seeing more cases where employees file lawsuits due to mental health damage caused by workplace stress, toxic environments, or lack of support. Mental health is no longer a personal issue. It's a business issue, a financial issue, and a legal issue. The good news, we can do something about it. Recognizing the signs of mental health challenges. Before we talk about solutions, we need to understand the problem. Mental health struggles at work aren't always obvious. Some employees seem fine but are battling stress, anxiety, or depression silently. Others show clear signs: missing deadlines, avoiding meetings, struggling with concentration, or becoming easily irritated. The American Psychological Association has found that chronic stress leads to high blood pressure, heart disease, and sleep disorders. The National Institute of Mental Health reports that nearly 20% of adults experience anxiety disorders, many of which go unnoticed at work, and the World Health Organization has identified depression as the leading cause of disability worldwide. One of the biggest workplace challenges today is burnout. The World Health Organization has officially classified burnout as an occupational phenomenon, and studies from Mayo Clinic found that employees experiencing burnout are 63% more likely to take sick days and 23% more likely to visit the emergency room. Recognizing these early warning signs is critical, because the earlier we intervene, the better the outcome. Mental health struggles don't go away on their own. They either get addressed or they get worse. What organizations can do, practical solutions for every business. The workplaces that get this right will attract and retain top talent. The ones that ignore it will face high turnover, low engagement, and financial loss. So how do we fix it? First, mental health needs to be built into company culture. If leaders don't talk about it, employees won't feel safe bringing it up. Harvard Business Review found that 80% of employees would be more likely to seek help if their leaders openly discussed mental health. This is why mental health training for managers is so important. Leaders don't need to be therapists, but they do need to recognize when an employee is struggling and know how to respond with support, not judgment. Next, organizations, big and small, need real systems in place. Large companies may have employee assistance programs and wellness initiatives, but startups and small businesses may not have the resources for structured programs. That's okay. Mental health support doesn't have to be expensive. Startups and small businesses can introduce low-cost, high-impact strategies like regular check-ins. A simple, "How's everything going?" can open the door for real conversations. Flexible work arrangements. Studies from Stanford University show that flexible work schedules reduce stress and increase job satisfaction. Even small adjustments can make a huge difference. AI-powered assistance. Lean teams can reduce decision fatigue and mental strain by using AI for repetitive tasks like scheduling, customer inquiries, or data analysis. Mindfulness and breathing techniques. Research from Harvard Medical School shows that even a few minutes of deep breathing lowers cortisol levels, improves focus, and reduces stress. Encouraging employees to take short mental breaks can prevent burnout. Inclusive leadership. Employees who feel heard and valued are more engaged. Simple practices like acknowledging challenges, involving employees in decision-making, and celebrating small wins create a mentally supportive environment. Regardless of size, every company can normalize mental health conversations. Deloitte's research found that 80% of employees would feel more comfortable seeking help if their leaders talked about mental health. This isn't just about awareness. It's about creating a workplace where it's okay to take a break, ask for help, and prioritize well-being.